Well, we are just days away from Christmas, a day where many of us will gather with friends and family. But just like last year, this holiday comes as COVID-19 hospitalizations have been trending upward, leaving many wondering if their plans with friends and family should actually continue. Local 5's Mary Sugden joins us now. Mary, you spent the afternoon speaking to local doctors. So what are they seeing in those hospitals right now?
So all three doctors that I spoke to say that they are at capacity. Even more specifically, they say that they are really overwhelmed. Now, they say that you can expect a long wait time at ERs and urgent care. And they say this constant flow of COVID-19 patients comes as hospitals are also experiencing worker shortages, which is why they're asking you to help do your part this Christmas to stop hospitals from getting even more overwhelmed.
But there is literally no beds available. So when you admit someone to the hospital, they could sit down in the emergency room for 1 to 2 days before they even get their inpatient bed.
Des Moines' three major health systems are sounding the alarm.
We were completely full last week, and we are operating at the highest capacity this week. And of course, we are doing the best we can, but the system is stressed. The clinics are seeing the highest amount of patients we've ever seen.
As COVID-19 infections continue to spread across our region, Mercy One, Unity Point, and Broadlawn say their resources are dwindling.
Our emergency room is jam-packed. There's people waiting everywhere. There's long wait times. I hear that's the case also in urgent cares.
And as COVID-19 continues, so do other emergencies like heart attacks, car accidents, and strokes, as well as other serious viral infections.
It's not only COVID. There is influenza cases that we're seeing are increasing. RSV cases are still here. All the normal coughs and colds that come with a season are here, and it feels like as soon as we come up for air from one COVID wave, the next one is upon us.
Which is why before you gather with friends and loved ones this holiday season, doctors say you need one of these.
Really, that vaccine, it's not bulletproof, but it really slows the amount of severe illness. It slows the amount of hospitalizations, the oxygen requirements, all the bad things with COVID. That vaccine has made a difference.
And even if you're vaccinated, they say being extra cautious with a quick test could make a major difference.
It does cost a little money. They run about $10 to $15 per test. But that's cheaper than giving somebody the gift of COVID for Christmas, where they might end up in the hospital or missing work, missing school.
Now, Stephanie, an important note with this testing, as we say, these hospitals very overwhelmed. These doctors ask really that you do that testing, at home or maybe in a setting like a clinic or a pharmacy. They say anything that we can do to keep people from going into hospital settings, that will all make a major difference.
It's a big goal right now. All right, Mary, thank you.